Hello guys, it's me Sanskriti Chapagai from Devda Medical College, and today we are going to discuss about the febrile seizures. And let's start now. And give me the feedback of this class in comment section so that I can improve um, my video in the next session. Thank you. ल पहिला सुरु चाहिँ हेरौँ है त पहिला सुरु चाहिँ अ 14-month old male present with fever of 1 day durations and abnormal jerky movements that last for 5 minutes. Okay, फिभर चाहिँ 1 day ड्युरेसनमा आएको छ 24 आवर्ससम्म आएको छ एबनर्मल जर्की मुभमेन्ट अफ बडी द्याट लास्ट फर 5 minutes. What further history and clinical examination will you help to make a diagnosis? And what are the characteristic difference between typical and atypical febrile seizure? Third number के छ is CSF analysis is normal and other findings are unremarkable. How will you counsel the parents and enlist the type of generalized epilepsy? ओके यो जानुभन्दा अगाडि चाहिँ पहिला चाहिँ वाट इज सिजर भन्ने कुरा जानु र एपिलेप्सी भन्ने कुरा चाहिँ जानु. सिजर इज एन एबनर्मल प्यारोक्सिजमल इलेक्ट्रिकल एक्टिभिटी इन द ब्रेन. ओके, abnormal paroxysmal electrical activity in the brain which is sudden, involuntary and time limited alteration in behavioral, motor, sensory and autonomic manifestation. What is seizure? It is an abnormal paroxysmal electrical activity in the brain which is sudden, involuntary and time limited. And there will be alteration in the behavioral, motor, sensory and autonomic manifestation. While epilepsy is recurrent seizure, it is a recurrent seizure produced by abnormal repetitive neuronal firing in the brain. And we have differentiate between seizure and epilepsy. And now let's go towards the previous slide. And for further, what further history and clinical examination will help you to make diagnosis? We will ask about the timing of seizure after onset of fever. If within the 24 hours, it is most likely febrile seizure. History to find etiology of fever. Maybe it can be due to the abdominal problems, GIT infections, UTI infections, meningeal problems, meningitis. And we will ask other associated symptoms like vomiting, irritability, cough to rule out pulmonary infections, pain during micturition to rule out UTI, and family history of similar episode of epilepsy. And now let's differentiate between typical and atypical febrile seizure. If the seizure that occur between 24 hours of onset of fever is typical, and if the seizure occur after the 24 hours of onset of fever, that is atypical. If seizure lasts less than 10 minutes, it is typical, and if it lasts more than 10 minutes, that is atypical. And if seizure is single per febrile, that is typical, and another one is atypical. And if seizure is generalized, that is typical, and if it is focal, that is atypical. Okay, if seizure occur within the 24 hour and it is less than 10 minutes, and one seizure per febrile, and another one is if it is generalized, that is typical, and another one is atypical. And now let's differentiate between type of the febrile seizure. It has also been classified into the simple febrile seizure and complex febrile seizure. In simple febrile seizure, it is generalized tonic-clonic seizures and symmetric. Here we can see that it has been symmetrically divided into the both hemisphere of brains, and duration is less than 15 minutes, and it does not reoccur within 24 hours, and there will be one seizure in 24 hours. While in case of complex febrile seizure, it is focal, means it is limited only to the one side of the hemisphere, and it is unilateral and more than 15 minutes, and it reoccurs, means in 24 hours there will be more than one seizures, and there will be tonic-clonic, atonic, myoclonic type of seizure. Now let's go to ask the pathophysiology of the seizure. Before starting about the pathophysiology, again let's revise what is febrile seizure. Febrile seizure is fever plus seizure, and there will be absence of central nervous system infections, neurologically intact, and no increase in temperature. There, it can be due to the environmental viral infection like HSV6, H1N1, and vaccine like MMR, DTPA, and human herpes. Another can be genetics, family history. If first degree relatives have epilepsy or seizure, then it is more likely to occur in the children, and age of occurrence of this kind of seizure is 6 months to 5 years. Now let's understand about the pathology, and first of all, pathogen will activate T helper cells, and CD4 cells will act with CD4 cell will act with MSC2 complex, and it will release cytokines like interleukin 1, interleukin 6, and tumor necrosis factor. This is tumor necrosis factor. Okay, and it will act on the NMDA receptors and increase its sensitivity, and glutamate neurons will be released, and it will bind to the NMDA receptors, and there will be flow of cations in the cells, and there will be depolarization, increase action potential. In seizure, what happens? There will be release of cytokines, and it will increase sensitivity of NMDA receptors. Glutamine will bind to the NMDA receptors, and it will cause depolarization, increase in action potential, and seizure. Another one is prostaglandin E2 will increase body temperature. There will be fever, and increase in basal metabolic rate, and increase in action potential. Another one is, if there is fever, there will be increase in oxygen utilization, and during oxygen utilization there will be increase in respiratory rate, and it will lead to increase in depth of respiration. And during the hyperventilation, CO2 will decrease, and that decrease in CO2 will cause respiratory alkalosis, and respiratory alkalosis which leads to the increase in depolarization activity. And we will find the cause of the fever, whether there is loss of infections or not, and there are meningeal signs or not, there is any kind of alteration, vital sign alteration or not, and viral exanthem. Like in case of herpetic lesions, we will see lesions in the oral cavity. And to rule out the diagnosis, we will do urine culture to rule out UTI, abdominal ultrasound to rule out the gastrointestinal symptoms, and chest X-ray to rule out the pulmonary cause, and to rule out the CNS cause, we will do lumbar puncture. In lumbar puncture, we will do culture, glucose, protein, and viral panel, and we will see whether there is decrease in level of sodium and magnesium or not, and we will do EEG, CT, and MRI. Okay, we will differentiate and make the differential diagnosis by ruling out the all the system. And to For the treatment we will do what we will do. For the treatment we will do abortive therapy. Abortive therapy is given if there is more than 5 minutes, if seizure persists for more than 5 minutes, or there is complex febrile seizure. First line will be lorazepam, and other alternatives are midazolam and diazepam. How this lorazepam will act? It will act on GABA receptors, and GABA will bind and chloride flow into the cells, and if chloride flow into the cells, it will cause hyperpolarization and decrease in action potential and decrease in seizure. Another one is we will give antipyretics like NSAID and acetaminophen. Okay, we can also see in this slide, we have already discussed like what investigation we will do. We will again revise. We will see CBC, sugar, calcium level, and serum electrolyte level, urine analysis, MRI, EEG, lumbar puncture, because in less than 2 months of child they won't be fully vaccinated for H influenza type B and pneumococcal, so chance of meningitis at that age is more. And we have done all these things, and I have told you about the treatment. In treatment, I have told you about the pharmacological treatment, and another non-pharmacological treatment is we will counsel the parents about these conditions. And for the control of fever, I have already told you we will give antipyretics, paracetamol, tepid and for the control of seizure we will give lorazepam. For prophylaxis, in intermittent type we will give clobazam, and in continuous type we will give sodium valproate daily. And to assess this note, you can comment down below, and I will provide you the note. कस्तो लाग्यो सेसन को चाहिँ फिडब्याक चाहिँ दिनु होला. Hope I made you clear about the febrile seizure. Thank you.